When is targeted therapy an option for children and adolescents? In the last video, we already talked about what targeted therapies are and how they work. This time we'll take a closer look at when targeted therapy is an option for children and adolescents. How this is decided? Well, first of all, it depends, for example, on whether it's a type of cancer for which a targeted therapy is already available. For children and adolescents, there are currently just over 10 targeted cancer drugs that are already being used as standard therapies. And these drugs work in several different ways, and the drugs therefore belong to different drug classes. For example, there's the tyrosine kinase inhibitor imatinib, which is used for certain types of leukemia in childhood and adolescence. Then there are the so-called BRAF and MEK inhibitors for treating slow-growing brain tumors, or also the so-called TRK inhibitors, which are used for all tumors that have a specific genetic change, the so-called NTRK gene fusions. But before it gets too complicated, we won't go through all the drugs in detail, or some of you understandably might tune out. So let's move on to the question, how do we actually know if one of these drugs can really help a young patient with cancer? To find out, a so-called molecular tumor analysis is performed. For this, a small tissue sample from the tumor is needed, which is often already taken during diagnosis, for example during a biopsy or surgery. In the case of blood cancer and lymphomas, cancer cells for the examination can also be obtained from the blood or bone marrow. In the lab, the tumor's genetic material is then examined closely for its specific properties. And that's how it's determined whether the tumor even has the right characteristic for the targeted therapy to be effective. In other words, doctors usually know quite early on whether your child or you as a teenager have a type of tumor that's suitable for targeted therapy. And if that's the case, they'll discuss with you how to proceed from there. For example, how the targeted therapy will be integrated into the treatment plan, or whether participating in a clinical trial might be an option. Of course, you can also bring up the topic yourself and ask directly if targeted therapy is possible for your child or for you as a teenage patient. After all, it never hurts to know for sure that everything possible and all options are considered that may help. At the moment, targeted therapies are still used relatively rarely in children and adolescents. The reason for this is that most of these therapies were originally developed for adults. Accordingly, many of these therapies target characteristics of cancer cells that are common in adults but occur only rarely in children. But if they do occur, targeted therapies can be used as part of a so-called individual treatment attempt or in clinical trials. What that's all about will be discussed elsewhere in the context of clinical trials. Another point is that many cancer drugs for adults are not even approved for children in the first place. In the future, however, all adult cancer drugs that could be just as effective in childhood should also be tested for children. And that is, of course, a very important step in drug management. Yes, to make these treatment approaches even more accessible. So I hope that has given you a good initial overview. Let's summarize briefly once more. Whether targeted therapy is an option always depends on whether the tumor has certain characteristics for which the drugs are actually available. And to find these specific characteristics, doctors examine the tumor cells and also the tumor's genetic material very closely. The results of this analysis then show whether there is a suitable drug that can work against the cancer. And even if targeted therapies for children and adolescents are still rather the exception today, it can be assumed that the more targeted drugs there are in the future, the more possibilities will arise from them. And in the next video, we will talk about how a targeted therapy actually works and what needs to be taken into account. So, check it out. See you then.